Welcome to Business Watch. I'm Chief Robert Osecki of the Brunswick Hills Police Department, and today we're going to be talking about MCDAC, Medina County Drug Abuse Commission. With me as my guest, I have Beckie Stolarski, Brunswick City Schools, Steve Hambley, Medina County Commissioner, and Michelle Bridwnthal, the new Executive Director of MCDAC. If we could start out with you, Michelle, tell us a little bit about the history of MCDAC.
Okay, the Medina County Drug Abuse Commission was formed 10 years ago by a passage of a property tax levy, also up for renewal in November. As Executive Director of MCDAC, I am responsible to and under the control of the County Commissioners. I also work directly with the MCDAC Board, which consists of representatives from the cities of Brunswick, Medina, and Wadsworth. County representatives such as townships, villages, Police Chief Association, Medical Society, commissioners in the schools. I assist in the grant process by evaluation and recommending criteria for grant awards by the Commission. I also do follow-up via reports, surveys, and visits. I also perform a variety of administrative tasks such as routine communication, maintenance of records, departmental bills, and the budget. I also try to maintain a current knowledge of the alcohol and drug abuse trends within the community by attending seminars, reading professional publications, and working with the local agencies within the community. Grant awards for the fiscal year July 1st through December 31st were just recently granted, and a total of $376,786 was just distributed. And the grantees were Black River Local Schools for $8,325. They have a drug prevention specialist who provides individual and group prevention services and also organize and facilitate drug prevention workshops for students and parents. The Brunswick City Police Department, $7,500. They have a school liaison crisis intervention program. Also, Buckeye Local Schools for $13,000. They provide drug prevention and intervention. Buckeye Local Schools, $13,000. Cloverleaf Local Schools, $22,372. They have the Huddle program within their school, and they also offer a lot of support groups for self-esteem, teen pregnancy, tobacco, HIV/AIDS. The OSU Extension, $5,250. They provide a parent education course to address parent skills to help prevent alcohol and drug abuse. And also Highland Local Schools, drug prevention programs K through 12. Medina City Schools, both the primary K through 12, offer a variety of different programs within their school system. The Medina County Sheriff's Department, $55,065 for the DARE program. The Medina County Career Center, $6,255. They provide individual and group counseling services to students and parents who have been affected by the alcohol and drug abuse. The Medina County Drug Task Force, $145,000. What they do is help to identify the drug traffickers, arrest and prosecute. And the City of Brunswick, a 12-step recovery program, which is an alcohol and drug-free club for recovering people. The Wadsworth City Schools, they also have a lot of different programs within their schools, work with gang resistance, mock trials, reenactments, programs on self-esteem, peer pressure. And also we have Brunswick City Schools and also Brunswick City Share Cluster Organization.
And that's why we've got Beckie on the show. She'll fill us in about the Brunswick City Schools and what's happening. Steve, as far as the county commissioners are concerned, can you tell us a little bit about your involvement and how you see things coming out to play in the future here?
Okay. Well, as Michelle mentioned, that we've got an issue on the ballot, a renewal, for the MCDAC, purpose of funding MCDAC, which is education, enforcement, and treatment. I think all three commissioners have voted to place it on the ballot before the voters. I feel very strongly to be in favor of MCDAC, have been all along. As a former councilman here for 5 years in the city of Brunswick, we could see the benefits. And this is, when you look at all the various programs that MCDAC funds, that it demonstrates the whole nature of MCDAC. MCDAC originally was formed actually through a grassroots effort, through the communities, had an interest in putting together programs that could custom fit the needs and desires, the demographics of each of those communities, but recognize that it's a county-wide problem. And the only way to do that was through the auspices of the county commissioners. And this was bylaws had been passed back at the beginning of MCDAC, and it's essentially a formal agreement between the county commissioners and the communities, who each have representatives, Brunswick and Medina and Wadsworth, and as Michelle mentioned. All these individuals appoint representatives to that board. They go through each of the programs, they evaluate them, make sure that, of course, they're spending the money appropriately and they're doing what they're supposed to be doing and seeing how effective they are, making sure that they're flexible. And I think that's one of the important things that has come out of the MCDAC programs, the demonstration that over the years, as people have changed and approaches to drug education enforcement have changed, so have our programs, and so, of course, the way we've been dealing with the problem. We've gained significant knowledge over the last 10 years. We've had I think, some great advances. There have been programs that have no longer been funded, and that's just the nature of it, and new ones that have been picked up over the last 10 years. And it's important to realize that that is the whole approach to MCDAC. It's one where not one size fits all, but every community can custom design their program, go to that board, seek the funds, if there be a school system, seek funds for that program, and of course then hopefully acquire those funds and then be evaluated on a year basis to make sure that they are effective, they are spending them appropriately. The county commissioners have indicated put that on the ballot. It's very important. As Michelle mentioned, we've funded only for the remainder of the year because that's all our current levy will permit. We've got in effect a half tank of gas. Well, we've got the full trip to make. And so it's going to be very important in November, of course, for the voters to be aware of the consequences of not passing the issue.
And that's why I really wanted to do this show, is because I feel that there's a lot of residents out there that maybe don't understand what the effects are going to be if this levy doesn't pass. And, you know, of course, this is not a campaign levy show, but it's just realities of life. And what it comes down to is that we've got to safeguard the county residents as, you know, things happen with crimes that go out, and I could speak to, and I'll be doing another show next month with Fred Wolk with the Drug Task Force, which is 100% funded by MCDAC. And if Drug Task Force goes away and there's problems, you know, that's going to affect us all financially and affect our business people. And that's another thing I wanted to urge and, you know, to tell our business owners to support MCDAC, to support what MCDAC funds, because it's affecting their bottom line also. As the children in the school, that's our future workforce that's going to be coming out. As Beckie was on a previous show about CARD, we talked about that. And also the statistics of substance abuse, and we'll get back to that later, how that affects cost and monies in the workplace. So it's everybody's concern that this should not be one group, from the youth up to the aged in the county.
Well, that's what MCDAC has been all about from the very beginning, comprehensive in terms of looking at enforcement, looking at education, looking at treatment in terms of dealing with this problem. That's why, and it is a countywide problem. I'm co-chair of the levy campaign for MCDAC, as well as Dean Holman, who is county prosecutor as well. And I think that demonstrates that we've got bipartisan support for this issue. It is a comprehensive issue and a comprehensive solution. And what we're asking is really to renew. And I think renewal is kind of the best way to look at this. Renewal means, in effect, that we're not going to be increasing property taxes with this levy. We are renewing our initiatives, and we're renewing and our demonstrated fight, of course, against drugs and drug abuse, and of course, with some of the problems that go along with that. And that they do have the significant correlation between crime and drugs, as you mentioned.
Well, everybody here we know on the show, we're working with it daily on a first-hand basis and see what the effects are. And things are not getting better out there. As people are moving in from the bigger cities to come into the rural atmosphere of our county, they're bringing in the big city problems of drugs, of theft, of their alcoholism problems, and we're dealing with this all on a county level. Beckie, how does MCDAC in the schools, what's the relationship?
Well, MCDAC, as Michelle pointed out earlier, there are many schools with grants, and those fund specific school programming, as well as one of the most unique resources that we have, and that's the SHARE Cluster. That's a county-wide organization of prevention, professionals as well as school-based people. It's an open group where we take a look at some of the data from Medina County and say, what do we need to do? For example, the good news in Medina County is that we're below national averages in all areas of drug abuse and state averages except inhalants. So what the Share Cluster did is in fact take a look at that as an issue and put together an inhalant workshop specifically to address countywide needs in that area. Medina County is fortunate because we have such collaborative, cross-working together, as Steve pointed out, to develop comprehensive solutions to a problem that's not going to go away because of the increased population and because nationally and culturally in our country, drug abuse is up. But if we compare what's going on nationally to Medina County, we are below. And I believe that much of that has to do with the fact that we have been, for the past 10 years, proactive, hard-hitting, aggressive in terms of looking at ways, comprehensive ways, through treatment, education, and enforcement to address and deal with issues. MCDAC is instrumental in supporting countywide school initiatives, countywide professional agencies and types of workshops and trainings to get the word out, to get more people involved, as well as specifically funding school issues. Our school benefits because we have 2 full-time people, partially funded through MCDAC dollars, that work directly with parents and students who are affected by alcohol and other drug issues. I have to say that in comparing to the rest of the schools that I'm aware of, I'm busier this year. Use is up, and the effects of the dysfunction caused by alcohol and drug abuse has a far-reaching impact. It can affect schools, as you pointed out, crime, vandalism. So it's not an issue that's just targeted in the schools. If school funding dies, businesses and community members need to be concerned about increased vandalism, increased juvenile crime, the relationship that alcohol and drug plays out in the community. So I think as we all feel and strongly believe, along with those citizens who started this initiative, and it was a very strong citizens-based initiative, that we need to remain vigilant and we need to remain proactive, that it's not an issue that's going to go away.
Definitely.
I think Beckie brings up certainly some good points. If I could elaborate a little bit, certainly in terms of the workforce, when you look at in terms of alcohol, even cigarettes and other drug use, the impact that has. We've got those kids that might develop that kind of nasty habit, and those are indicators that down the line that they could grow to utilize more illicit substances, and when they, of course, enter their workforce and they're there working for employers, that has a significant impact, not only in terms of the dollars, and I mean direct impact on the proficiency, but also the profitability of that organization. It's hard to compete when your employees, somebody else, let's say a foreign manufacturer and so forth, it's hard enough as it is. When your workers are maybe not as proficient, maybe they have drug problems, it's very difficult to compete on that basis. So you can see that that has wide implications, not only in terms of the schools, the community, but also in the workforce as well.
Mm-hmm. I think employers and community people have to be aware of the fact too that it's harder to retrain. If you've got a professional on the job and you're looking for somebody to replace that person, sometimes it's better to intervene, do what you need to do to get that employee back to the workplace rather than fire and have to retrain and retool an entire organization. So prevention, education, intervention is a key in doing that, and I think businesses are looking at that. You hear more now about pre-employment drug testing today and culturally across the United States than you've ever heard before, and that's because people are trying to screen out, but then the next step is, what do you do if it comes to my place?
Yeah. But even just look at the society costs. If you said that with that employee, rather than losing them, and certainly if they've been drinking on the job and you get rid of them, but they're still out there. They're either collecting unemployment or they're going to go out of welfare or they're going to try to find another job and not get rid of their problem. It's best to try to deal with the problem. And certainly with MCDAC, the approach is to look at it comprehensively, holistically, if you will. Look at at all those age spectrums, not only children and teenagers, but also middle-aged and people that are professionals, those in the workforce, workforce and so forth.
And the elderly. We can't forget about the elderly population in Medina County. They're affected by alcohol and other drug abuse indirectly through possibility of increased crime, increased intimidation, as well as their involvement with medications and that relationship that alcohol might play. So doing some education and awareness in that population is equally as important. So as you say, it's not just one target population that we can focus all our efforts on and say the problem will go away.
And getting back to the grant process with Michelle, she went over the money that was given to the grantees, and of course, like you brought up, Steve, that's only for a half to the fund to the end of this year if the levy does not pass. The grant process itself is an interesting concept, and I've been on the board for 3 years and have found out some very interesting success stories here around the county. Brunswick City Schools with the liaison program, and I'd like Beckie to talk a little bit about that if she could. But with the liaison program and the different programs we're doing in Brunswick aren't necessarily the same things that they may be doing in Wadsworth. So MCDAC is not a one prescription fits all type of program. It's you come to the board and the board recommends to the county commissioners how to fund these programs. And with the representatives that are placed on MCDAC on the board, like was voted by the police chiefs to represent them as their representative, as the Brunswick City Council, and that picks who they want to represent them on the MCDAC board for Brunswick. Same thing in Wadsworth. The medical profession that's involved, the Doctors Association in the county medical board picks who they would like. So basically we've got a lot of people, and I'm not counting myself in this of course, but a lot of professionals that are handpicked and are there because they're doers and they're people that have a good handle on the needs of what the county is, and that's why the political bodies and the superintendents and everybody else has picked these people to sit on a board. So you've got a diverse group of education, a diverse group of experience, and people that get together and know each other and know what is good.
I think to add to that, Bob, is a good point. I've had experience working with federal grants, state grants, and of course the MCDAC grant. And accountability in tax dollars is always essential. How you report back to that funding source in terms of what you're using your dollars for. I've been in grant review process as a grantee, a representative of Brunswick City Schools. And I have to say that the board is not unafraid to ask the right question. And the right question meaning they want to be sure that there's accountability. They want to be sure that monies are spent appropriately, so they're unafraid to ask for that accountability. And it's been my experience that, like with the Share Cluster in Brunswick City Schools, that's not been an issue in order to show the county through the MCDAC board that monies are in fact being spent appropriately and for Brunswick to fit our needs. And I think that's critical too. Wadsworth and Brunswick are different communities. So for us in Brunswick, the liaison officer program is an excellent fit. I mean, it's something that works for our schools, works for our community, and we don't have a funding source telling us that we have to use it this specific way. So we meet our needs plus the fact that we're also held accountable. And that gives the county voters a guarantee that monies are being spent for what they're supposed to be spending for.
It's a very good point. And I've worked with different county commissioners. Steve is just on, of course, starting this year. And the support of the commissioners that MCDAC has had historically has been fantastic. And I know that that's going to keep on being that way because the commissioners are broad-minded enough to know that they have to safeguard the residents of this county. As far as Steve's concerned and Commissioner Pavlovitz and Pat Geisman, I've had conversation with all at one time or another and asking me specifically about grantees, how the money, do we feel that the programs work. So there's a lot of accountability, and that's the main thing. It isn't just voters' money out there that isn't being accounted for. And I don't know if you had mentioned it or not, but is this levy, is it a raise in taxes for the county residents?
No, no. As I mentioned, it's a renewal. What that means is that it's going to be taxable at the same effective rate. So for any individual that would vote for the MCDAC levy, it would be no virtual increase in their property taxes. And I think that's certainly one of the benefits. We've had an improvement in our tax base. We've had industry and commerce move in over the years, so there's more and more of that sharing that burden. And I think that of course, I think makes it better sell, makes it better for everybody all along. And certainly, if I could re-emphasize the process in terms of the commissioner's role in that. Certainly, every county commissioner, when they put their signature, they vote to approve those funds, is looking at each of those programs. And when they approve those funds being spent on that purpose, are fully aware that it's of course, at the recommendation of that board who are holding those programs accountable and using the money appropriately, and they're making sure that they're effective. Every county commissioner that voted for that, obviously, is putting their name on it and saying, we approve of this program. We think this works for the county because you, the communities, have said this is what you need. And I think that's going to continue as MCDAC can continue, and hopefully with the levy passage in November will continue on to the next several years.
And I think if dollar per dollar, if we look at what that would cost in terms of a year and look at what it provides, the benefits can't be measured in terms of how do you measure someone's life if they've been intervened upon, how do you measure the success of a business because somebody did not lose their job because help was available, how do you measure educating a community of children and that allows them to be alcohol and drug free, how do you put a dollar sign on that? So I mean, while we talk dollars, it's really hard to measure out, and when you look at what's the payoff for the county.
And it goes across communities as
Right.
well. Just to give you an example, I met a waiter actually at Eaton Park. He was working one of the booths there, and that he is a graduate of the 12-step program here in Brunswick. Now, he's a resident of Medina City, and a lot of people say, well, because it's situated in Brunswick, it doesn't help anybody elsewhere. Right. And of course, he benefited. In fact, he's gotten his life back together. He's now going back to school. He's trying to, of course, he's earning a degree at the University of Akron. He's working his way back up. How do you measure the impact on that person's life? You could try to assign a dollar, but I mean, it's unfathomable.
I think the other thing is that Medina County has been proactive. I've had opportunity and have been invited to speak to other counties on behalf of how did you get the collaboration? And we talk about the fact that, for example, the SHARE cluster has been in existence for the entire time I've been full-time in the prevention program, and that's 10 years. And some of the successes in programming and institutionalized low-cost, no-cost services to Medina County. And we have historically been a group of people who have worked well together, and I think that that's unique. And it's my hope that with the new people coming in, whether they're bringing issues and everything else, that we can still maintain that flavor of Medina County, that collaboration, that uniqueness, that we are aggressively looking to keep our county safe.
Absolutely. Michelle, in all fairness to you being new on the job, I know that you've been quite busy trying to set things up, going through the paperwork and a lot of history there at MCDAC for 10 years of records and that. But I know that you've went out and spoke to some of the grantees. Can you share a little bit about that and who you've seen and kind of some of the particulars of how their programs are different?
Okay, well, for the past 2 weeks, I have been out in the field. I've met with Diane Goins over at Cloverleaf Schools. I think Cloverleaf has a very unique program over there. They have the huddle, which of course is comprised of team leaders who go into the different grade levels and teach lessons on self-esteem, tobacco, HIV, AIDS. I think that's wonderful. I think that's what the kids out in the community need. Let's see, I've also talked with Beckie of her program over at Brunswick. Also a very strong program over there. Medina City Schools. They have intervention in grades K all the way up through 12. They offer many different lessons to the children. The Share Cluster organization, I think, is wonderful. I think that's a great resource for all of us to pull together, you know, to help meet the program's changing needs.
I think you told me that the Cloverleaf, and correct me if I'm wrong, hopefully not the Cloverleaf, that their program is so flexible that every year, that previous year helped design that program.
Exactly.
So that actually it evolves.
Exactly.
And improves every year, which I think is, when you look at government-funded programs, that don't necessarily have that character.
Yeah.
And that's one thing unique to the course, Medina County's approach to this.
Yeah, the team leaders, they, kind of come in, and say, okay, this is what I feel the problem may be, let's focus on this.
Yes.
They had like a teen pregnancy organization this year, and they put together a little booklet to be handed out, and I thought that was great.
Getting the kids involved in that whole process, I think that's what it really is about, too.
Absolutely, absolutely.
Definitely.
I'd also like to mention that over at 144 North Broadway in the County Administration Building, we have a resource library there, and it is available to the public at no cost for people to come in. We have books, guides, videos covering topics all the way from HIV, AIDS, tobacco, family violence, drinking and driving, family information. So if anybody would like to come in to get that resource information, they're more than welcome.
And that's important information because much of what's in the resource library is current. And
Yes, it is.
I know when I get calls from parents in terms of what do I do or where can I get information on, it's a good resource for the county to be aware of because it is current.
Yes.
If anybody has any questions concerning MCDAC or how to get a hold of the resources, how can people get a hold of you, Michelle?
They can call me. My phone number is 722-9263.
Okay.
And if I'm not available, they can leave a message with the secretary there, and I'll return the call.
Or even Brunswick can go through the main exchange, 225-7100.
And also, that would be to get a hold of you, Steve.
For me, or you can even call me at my home phone number, 225-0436.
Oh, but you are supportive of calls at home. I like that.
Always glad to talk to the public.
I wanted to bring up some other statistics here that are just staggering that we've got together about the cost of substance abuse. It's estimated that in Medina County that there's $70,000 per year spent because of substance abuse, and that rounds out to about $500 per person in the county. Also, some of the statistics that are closely linked is that we feel, and through our research, that alcohol and/or drug abuse has some input into 40% of all traffic fatalities, 52% of rapes, 49% of murders, 68% of manslaughters, 62% of assaults, 38% of child abuse cases, 59% of spousal abuse, of course with domestic violence, 70% of all teen suicide attempts. And I'm sure that Beckie could definitely agree with that, with the problems that we've had up here in this area. And also 70% of all drownings involve some type of abuse like that. And also with the crime, with the sheriff's department, all the other agencies in the county, the businesses, the lost time for workers, compensation costs, health care costs, and that as the consumer also watching the show, that's built into the cost of every product that you buy, from a sandwich all the way up to an automobile. These are all costs that are involved with that. Also with our jails, it costs taxpayers in this county $27,000 on average to house a prisoner for a year. That's big dollars. And Steve does the budgets for the county. He knows that those are big dollars out there.
Oh, yeah.
Treatment for government and private facilities, the money that's put out there. Health care with hospitals, clinic, and also use of the health department. And counseling as schools, nonprofit and profit organizations. And also, we've got the groups like the DARE and the Huddle and everything else that's involved. So I just wanted to close the show, because we're running out of time, with those statistics to just show the people viewing how totally encompassing that this situation is and the effect that it has. And I'd like to thank all three of you for being on the show. Some very interesting information that I'm sure that might surprise some of our viewers.
Hope so.
So thank you.
Thank you for inviting us.
Thank you.
Now I'd like to thank you for tuning in to Business Watch.